Welcome to 65. It's that show where we dive into and deal with issues and challenges about the elderly. And we pick timeless wisdom that we can gain from their peculiar experiences. I'm your host, Dr. Stella Dorgu. Today's program is truly special. We are talking to a medical expert about some issues concerning aging. Professor Consultant Adedayo Ejiwumi, you're welcome to the program.
Thank you very much. Glad to be here.
In simple terms, what is aging? What are some of the physical and mental challenges that people who are 65, 75, 80 and going on, what are the challenges that they face?
Well, maybe to put it most deliberately, it is a degenerative process in which almost every organ of the body becomes smaller and less efficient as the years go by. Smaller in the sense that some of the cells of an organ may die and not be replaced. Less efficient in the sense that the physiological processes, the normal functional processes, slows down, and the body is not able to do what it had been able to do when it was younger. On the other hand, there are organs which get bigger with age, and yet it is not because they're getting more functional, but because in old age they become bigger, and they may constitute a problem for the older person. For some of us, we probably would associate that with the prostate in males, increase in size, cancer, and things like that.
Do our genealogy and family history influence how we age, for example?
Nature and nurture. It's what really controls most of our life as human beings. Nature is what we are born with, that is our genealogy. Nurture is how we are raised, whether we are, how we are fed, what kind of lifestyle we had when we were younger. So yes, our nature may affect what happens to us as we grow older. Especially in issues like cancer, which is something which now we know that a person who has cancer in the family ought to have more examination with respect to that particular cancer, basically, and other types of cancer, because once cancer is in a family, it's as if the family has a tendency to have other predisposition to have other cancers.
And you've talked about lifestyle.
Yes.
The foods we eat.
Yes.
The things that we do.
Yes.
Are those things in any way able to ameliorate maybe the onset of the aging process? Because you said at the onset that aging is a degenerative process.
Yes.
Or is that too?
No. It's just that it's difficult to say whether a person who exercises, for instance, a lot as a young person, would necessarily live longer. I don't think there's any hard evidence to that effect. But to exercise is good as a lifestyle. Whether or not it would lead to a longer life with without any degenerative processes is another matter. For instance, if a person is used to running all the time, okay, as for exercise, it puts a lot of pressure on the joints, especially the knee joint. The knee joint then may wear out in that kind of person if, for other reasons, the person may have a degenerative knee joint. So exercise is good for the body, but it does not necessarily mean that with age, the person would be healthier than others.
From your professional experience, what are some of the unique challenges that older people face in Nigeria?
Takes me back to the days when we used to go and see orthopedic cases at Igbobi, and it was particularly striking that women end up with having a lot of backache because the part of the spine, part of the vertebral column degenerates, and that happens earlier in women than in men. Arthritis is also a major problem, and then some of the organs of the body which are exposed to various toxic substances over the years may also become degenerative in the old age. The liver and the kidneys are very important ones. The kidneys, because they're exposed to a lot of toxic substances which the liver cannot deal with, may damage the kidneys directly. Substances which are directly injurious to the liver, all right, may make it less functional. Like alcohol is one. Tobacco and lungs is another. All those things particularly affect particular organs, which, like somebody was saying yesterday, if I smoke and I exhale the fumes, and my wife doesn't, a wife may end up with lung cancer.
Second-hand smoking.
Second-hand smoking, because the husband smokes. And so the husband may not have cancer on the lungs.
More and more people, it is said that very soon, about 60% of our population will be old.
Okay.
How do we take care of them when we have so many old people and there are younger people? How do the young people take care of this population of people who are frail,
Yes.
who are dependent?
Yes. Okay. Well, maybe there are several ways of doing so. Let me give you an example of what I thought about yesterday. I'm told that there are 42 million diabetic patients in the world. Mm-hmm. All right. Diabetes is one of the degenerative diseases. It affects almost every organ in the body. 42 million is 0.6% of the world's population now. 0.6%. One way of doing it, if you have a very what's the word to use? A ruler, a global ruler, right, who has the rights to do anything he likes with the population. Get rid of 0.6%. You have 94% left to live. Now, I'm talking about, because some people think that the time will come when you have a global dictator who can take decisions that you and I would not take, either in our personal life or in our family life or in our immediate community. But because the person wants to preserve the greater population. So what's your problem? Get rid of those ones. Let's deal with 94%. So that's one way of dealing with it. Another way of dealing with it is to be more compassionate, create more compassionate. Well, that's masochistic, but you can also create a more compassionate community. But to be more compassionate means that you need to have more facilities, more money, all right, provided for those who need it. And that's again depends on the kind of leaders that we have. You know, a more compassionate leader will say, okay, fine, we'll look after them. We are making enough money. We are creating more facilities, so why can't we look after them?
In terms of aging, would you say that, just like what you have said, a better primary care, health
So that's
sector would help us to deal more with the health challenges that will come when people get to be old?
Yes, that's part of the facilities that will need to be created. In other words, have a system in which anybody who is in need from childhood to old age should be able to have access to what they need for staying alive. In the Western world, you know, one reason why many people leave the country is that they can at least work in a system in which old people are given maximum care and they pay well for it. It's not the best kind of job, but they pay well for it. And people, well, one other aspect of this aging is mental degeneration, Alzheimer's disease and things like that, dementia. They are things which most people cannot deal with in their homes. So the government takes that over and employs people to look after them.
But we haven't gotten there yet in Nigeria.
Well, we ought to. I mean, we know, or I grew up, for instance, with knowing that if you have an old person whom you cannot deal with at home, there's an old people's home near Queen's College. It is still there till today.
It is still there, but that was not a very positive way. I remember going and finding all those old people. They were almost like the castaways that were there.
Yes, because we have not developed it. If you have a compassionate community, a compassionate country, that's something that should have been developed beyond what it is today. I think it's improved a bit, but as you know, in most Western countries, if a person is put in an old home, it can be an old home that's like a hospital. It can be an old home that is a private home, a one-bedroom thing, in which even if he cannot look after himself, the government will provide persons who will look after them.
And that would ensure that the person maintains a good lifestyle.
Yes. I know a woman right now who is living with her husband in America.
In a home.
In their home. And they have people looking after them in their home.
Yes, we can't afford it.
We haven't got that, but we can afford it if we manage our resources well. But we're not managing our resources well, so there's nothing.
Dementia seems like it's on the rise, or maybe people are talking about it more.
Yes.
Because I have a close relative, very close relative, that has dementia and has lost most of his cognitive faculties or abilities. Is there anything that, from your professional perspective, that can be done to stem the onset of dementia in older people?
That's the subject of a lot of research now. I don't think there is any solution yet. It can only be managed. I don't think there's any solution in view, as far as I know right now. One just has to be supportive to the patients, and yeah, we've spoken a lot about government giving support, but it is even more important for relatives of such people to be willing to give support.
Can dementia be reversed?
Not yet. Not yet. But it can be helped.
It can be managed.
Yes, can be managed. To see a person with dementia, with loss of memory, inability to communicate and all that, just smile, because certain people were able to bring about a change of attitude. Can be a great relief. Can be a great relief, even to the person who is observing. Is the person is observing. We may not even know how the person feels. But if a person who has dementia can be related to in such a way that the person, the patient, for a brief moment, has a change of mood. I was reading recently about a husband whose wife had dementia. And every day he would go in, sing, pray, talk, even if he does not see any changes, but he does it regularly. And as some people say, sometimes diseases are not for the patient, not for the doctors, but for those who are caring. It may make a lot of difference to their lives, that they are able to give something to somebody, whether they appreciated it or not. It can be transformative.
You talked about nursing homes. Sometimes when people talk about nursing homes, it leaves a bad taste in the mouth. Because the example that you gave, and many other examples, and in Nigeria, we feel almost like it's a taboo to have your parents or your relatives in the nursing home. But we've had other conversations, and people suggest that it is the signs of the times that we will be having more nursing homes for various reasons. People are so busy, people cannot medically take care of ailments of these people, and so it's better to take them. What is your view about nursing home care generally?
I think we are too slow in developing nursing homes. Too slow. I was part of a church setting in which this proposal was made, and a fellow, one of the members of the church, a priest, gave exactly this argument, that it is not our culture to treat ill parents, let's just put it ill generally, outside the home. And I said that's just hiding,
parochial.
Not just parochial, but denying the reality of of the present situation.
Because sometimes we can't take care.
You can't. Most people can't. It's too intensive. It's too intensive. So why not just provide a facility that will be able to do?
Because people even say something that sometimes the pressure is more on the person who is taking care of the sick, on a relative, than the relative himself.
The relative will soon die.
People have talked about the fact that the person who is taking care
the one that will die
because of all the stress in managing this person.
Yes, I mean, we have a couple like that now, a couple of my age, 80, 81. The wife managed to escape to England recently. When I came back only to find the husband ready to go to hospital.
Wow.
That's what she's looking after right now. We just need to be more realistic, honest, stop hiding our head in the sand. I think that nobody is seeing us.
Is there anything that we can do to prepare for aging? Is there anything? Because it will come.
Live well. I think that's the best thing. Live well and avoid the obviously known poisonous things. The two that are very clear, which are surely harmful, are tobacco and alcohol.
Today, the drugs.
Well, no, the drugs you have to go and look for. Really look for
Do
it.
you
because
really need
it.
to look for them? They come
But
to you now these
alcohol
days.
is so much more easily available. I mean, you know this
The
sachet?
sachet. Oh God.
Yeah,
Yeah.
they're all over the place. The government tried to stop it, but I presume the economy is too much in favor of those who make it, and the pleasure is so much for those who drink it.
Altering people's chemical balance. Yeah. When you take alcohol, something goes.
Yes, and people they do it every morning. I mean,
Wake up
they
and it's
just
the
wake up
first
and
thing.
start drinking the sachets. And yet, it is one of the most dangerous things. It is directly poisonous to liver cells. It's the only thing that we know that has been directly poisonous to liver cells.
And it may even have an impact on the kinds of children that will be born.
Well, I don't know about that yet, because that means that it will have
There
an
hasn't
effect
been
on
the cause
on
and
the
effect
yeah
on
but,
the fetus, but
yeah,
we know
yeah,
that
fetus.
drugs do
Yeah,
have an
but we
impact.
know that alcohol affects fetuses.
Yes.
Alcohol affects fetuses. So does tobacco. They affect fetuses. So I think that okay, let's avoid things that are known to be directly harmful.
Here you are at 80 something. You're looking dandy. You're looking like you're maybe in your early 70s, mid 60s to early 70s. Were there things that you had to deliberately avoid? Stresses, not sleeping enough, having a good diet like having beans, your legumes, vegetables, and things like that, you think?
I did not think about aging. My father died at 52.
That was young.
Yes, it was very young. But his mother
What did he die from?
died from complications of hypertension.
Okay.
His mother lived for a long time. His younger stepbrother also lived up to 90. So it wasn't as though
there was a pattern in their genealogy.
No, right? If there was any pattern at all, it would be that living long was in the family. So maybe that is what I and my brother, who is also 85, have inherited. I have an older brother who also died early 70s. So maybe nature has conferred longevity a bit on us. Then I used to drink alcohol. I smoked a bit, but in my very younger days, and when I became a Christian, that stopped. So my life pattern changed.
Your lifestyle.
My lifestyle changed from about when I was 7 or 17. Had changed. So and then I exercised a lot. I was a fairly good footballer. I did a bit of athletics, and I didn't. I had enough to eat. Let me put it that way. Enough normal good food to eat, and those are essentially the things that maintain a person's health: good rest, food, exercise. What else? Those are the essential things that keep a person
Something like hypertension.
Yes.
Seems to be like very common, an epidemic.
Yes.
But nowadays, people can't even afford to buy the medication that should keep them going. What should we do?
The pharmaceutical industry in Nigeria needs to be developed. Secondly, we need to find drugs that are maybe locally made, either from our herbs or from imported things which can be affordable. But then perhaps the major thing is that we ought to reduce the amount of stress that people pass through in life.
Talk more about that.
basic national salary is too small to sustain anybody. And this morning, I don't know whoever is going to be listening to this, a person who was employed and was told they'll be earning about 150,000 naira a month. With 4 children, that is still a lot of, it's still not enough to sustain them. For the person for whom he's working, to now have that money paid into his account and deduct 50% of it to himself, the person for whom he's working, no. Yeah, but it is a stress on the man. If he keeps living through that, I mean, he will end up with having a hypertension. Whatever the cause is, I agree with you. The reason for doing it is ethical, it's moral. But the upshot of it is the stress, the greater stress on this person whose salary is not even enough yet, and yet is now made worse by this unethical behavior.
Man's inhumanity to man.
Yes. So, and I mention that because when the NLC started asking for an increase in salary, they were not asking for 70,000.
No.
They were asking for 400,000.
Yes. Because they were basing it on what
on
the
realities of the market.
UN or WHO or whoever is making those things, or ILO.
I would say we can't pay 400,000. You're paying 70,000.
Yes.
Can you imagine that if a person is now paying 70,000, all right, the person for whom he's working out deducts 30,000, and say you can go home with 40,000. I mean, the person will end up with hypertension, from stress.
And we see all the stress factors on the streets. Look at the chaos.
The chaos on the streets, the buses that you cannot take. There's so many other things that are adding to the stress. Stress, everything that is stressful will increase the possibility of hypertension. And it is such people who will go and eat things that will contain some measure
toxins.
of toxins, which will also damage the kidneys. Well, another thing that we should do to minimize it is to find the hypertension early. Find it early. When we started medical school, their consultants were telling us then that up till that time, hypertension was said to be minimal. But they came, and almost every week there was one fat market woman who had suffered stroke and was in hospital because it was not discovered early. Now, the possibility of discovering it early is that everybody should check their blood pressure.
Is there enough sensitization? Is there enough awareness?
I think so.
Or are people still in denial?
Well, maybe a little of that, but I think there's a lot of advertisement and awareness campaign now. But the availability may not be there.
Of the drugs?
No, of even taking the blood pressure. If you had more clinics near the markets, for instance, like I'm just walking, I want to check my blood pressure, things might be better.
Well, thank you very much.
Thank you very, very much.
To us about aging, the process of aging, and some of the things that we can do as we progress to minimize and maybe take care of ourselves better.
Thank you very much.
We've been talking to Professor Adedayo Ejiwumi about the aging process and some of the things that we can do to reduce those stress factors that exacerbate the degeneration that must come about with aging. We've come to the end of another program of 65. Please join us. Share, like, watch us on our social media handles: YouTube, Facebook, Instagram. Share your comments with us and tell us which other topics we can deal with in our forthcoming issues. Until I come your way again, it's bye for now.